Welcome everyone to today's webinar. We have a really exciting lineup today to talk about integrating 3D printing in medical education. We have three speakers, Dr. Robert Pugliese, Rachel Monane, and Sara Belko. And I'll just tell you a little bit about them. Dr. Pugliese serves as the director and the co-founder of the Health Design Lab at Thomas Jefferson University, where he also leads the Scholarly Inquiry Design track at Sidney Kimmel Medical College. This program features future physicians, or teaches future physicians to think like designers to become better creative problem solvers primed to tackle complex challenges in healthcare. Segmentation and 3D printing are essential tools that expose students to future-facing technologies, reinforce medical skills, and enable student-led research. He will be joined today by two amazing current senior medical students and previous health design research fellows. Again, soon to be Dr. Sara Belko and Rachel Monane. Before we start, I just want to do a few housekeeping items and remind you that this is the RSNA SIG. RSNA is our parent organization, fantastic, with a mission to promote excellence in patient care and healthcare delivery through education, research, and technologic innovation. A quick update for those who may have missed it. We launched as the 3D Printal Special Interest Group, but we have just refreshed our name and our mission to be the 3D Special Interest Group. The printing was dropped to be a little bit more inclusive so that we are now including beyond 3D printing, immersive technologies such as VR and AR. So that's very exciting. Within the special interest group, we have 4 subcommittees. I would encourage any and all of you to join these. We have education, appropriateness, and that's for appropriate use of 3D printed models and other advanced visualization such as AR and VR, as we mentioned, quality assurance, and outreach. Also, remember, RSNA is rapidly approaching. I know it's still the summer, but before you know it, it'll be fall and winter, and December 1st through 5th are the dates for this year's RSNA, and registration is open. So go ahead and register for that. We're going to have several events from the 3D SIG, including the 3D SIG Showcase. This will be at the noon hour, and we'll highlight different 3D printing cases each day and provide the visitors hands-on interaction with the models, which is really exciting. And we're having the top model competition again. So think about entering models. We also have the symposium, which is a 4-hour session. We would love to have you join us for that. That's on December 5th from 12 to 4 p.m. at McCormick Place to follow with the RSNA annual meeting. We also have the SIG forum. So this is something you could submit to as well. And you can see that on our webpage, a new exciting opportunity to share out your work in the forum curriculum. And then finally, we have the special interest research grant launching again. It's $2,500 this year, which is exciting. The application deadline for this is September 30th of this year. So please consider doing that. Thanks for joining us today. Without further ado, I want to hand it over to our speakers. Here's our QR code if you want to find out more about any of the things I mentioned.
Thank you so much, Dr. Ripley, for that awesome introduction. I will second that pitch for RSNA in December. It is my favorite medical conference that I've ever been to, and I'm not even a radiologist, so that speaks a lot. I love, it really is an awesome collection of, the smartest people and the most forward-thinking people in the space that we're kind of discussing today. So I encourage anybody, if you haven't been there before, to do it. It's really amazing, and an amazing community to pipe into with the 3D SIG leading it. So thank you so much for doing that. And thank you everybody for being here today. The USA Women's Gymnastics Team Final is set to start in about 15 minutes. So please, it'll be rebroadcast later on this evening on primetime, so you don't have to leave to watch it unless you're a Biles super fan, like I think the entire country is. So thank you for foregoing that to be here. And just a second, again, thank you to the RSNA 3D SIG for continuing to do this work to bring us together and educate everybody on the power these technologies can have on patient care. Okay, so Beth already gave a great introduction, so I don't need to reintroduce ourselves, but I do need to share my slides, so just give me one moment. And let me just do this, and wonderful. Okay. So, what are we talking about today? Beth gave that kind of introduction and she mentioned the word design, and I like that today will probably be a little bit different of a presentation than maybe you've heard from the RSNA SIG before, in that we're going to be getting into some design terminology, and my goal here is to have everybody leave having a few of these questions answered. So one is, why do we teach design to future doctors? That's a big one. What is health design thinking? How do we teach design to medical students? What does this have to do with 3D printing, quite frankly? And you'll see quite a lot. And then lastly, the part that I'm most happy about is because we're joined by Sara and Ray, two former fellows and current medical students here at Jefferson, to hear their experience being two extremely high utilizers of these technologies, and they'll be able to speak on what that has meant for their journey through medical school. So a little bit of context on where I am sitting. I'm at Thomas Jefferson University. It's part of a large, comprehensive, academic medical center. We have 17 hospitals in Jefferson Health. We have a health plan, and Thomas Jefferson University houses one of the oldest and largest medical colleges in the United States. We graduate around 250 medical students each year. It's a great place to be with many kind of diverse opportunities, and that's what we'll be talking about today a bit. So I am sitting in the health design lab. It looks like I'm in a basement because I am, except our basement is also a giant bank vault. For those who are familiar with us, you've come to know the giant vault door. It's our kind of logo and brand, because it's where we live in this basement, surrounded by our 3D printers and other fun things. If you're interested at any point in learning more about what we do, you can just go to our website at healthdesignlab.com. And the lab is both a space, it's a series of programs in a research center, and we focus on the intersection of health and design. We were founded around 2016 on this premise that understanding why things in healthcare are designed the way they are and how to make them better would lead to exciting improvements. And our primary learners in this space are medical students. However, we do teach these concepts to people from around the world, from high schoolers, who I really love kind of exposing them to this type of work, to kind of C-level executives who want to learn about how they can design better processes and systems in their own spaces. So let's get into the why. So that's where I want to start today. I want to start with why. Why teach design to healthcare people? The way that we like to talk about it is about why design is so important and generally really awful in healthcare is by highlighting the failures that are so common. So this one, everybody I'm sure immediately recognizes. It's a very common example of poor design in healthcare, the patient gown. It's almost universally hated by patients. And the thing I like to ask our learners when we're talking about this particular example is why? Like, why is it so bad? And yeah, I'll have everybody just kind of stop and think about that for a second, right? Everybody immediately will say, well, because, it only covers your front and nobody likes having their butt hanging out in a public place. Of course, that is one of the whys, but really it's because the question of who was it designed for, right? The original patient gown, as you see here, was not designed for the patient. It was designed for the people who need to have access to them, right? Clinicians, doctors, and nurses, and different folks doing exams, they needed quick access. So that's why patients hate it, because it was not designed for them. Here's another classic example. I see this as a symbol. It should be on a flag outside of our lab, actually, with like a big cross mark on it. It's a symbol. I see this as a symbol of our failure to design systems that actually work together. I mean, we've made great strides by all means, but really fax machines continue to exist. They're like cockroaches. We can't kill them. And we still find ourselves using them to get data from one place to another when there's no better way. Anybody who's worked in a healthcare space knows what this is, right? This is an older picture, I'll admit. It's been a little while since I've been in the ER, but this is me working in the ER. And you can kind of, immediately brings to mind, like, this is a space where some of the highest pressure scenarios and the most high functioning people exist. However, this space was not really designed to do what we needed to do, right? I'm surrounded by stuff. There's just papers and trash and random stuff everywhere. There's a patient bed in the hallway. You can't see it, but there's actually a waiting room, like a patient waiting room directly behind me, which was really great for productivity and focus and safety. And looking at the spaces in which we exist, it's no surprise like why we have a burnout problem in healthcare, right? Being that we're forced to do really hard and important work, but in spaces that are not really considered much. And then this is, I specifically picked this out for this audience. I don't think I need to explain what's happening here because everybody in radiology probably has seen this. Somebody taking a picture of a screen. And, this is the thing I like to point out here is when we don't have the tools that we really need to do the jobs that we need to do, what people will do is hack the system. And one superpower, this is like something to keep in mind, a superpower of a designer, the designer's mindset is always to look out for these hacks. Because while we might see it as like why do you have to take a picture of this to send for a consult? There should be a better way to do it. And I'm sure in many places there are. A designer sees this as an opportunity, right? This is an opportunity to make something better. Because what the person here is showing us is that he has a job to do and he doesn't have the right tools. So how can we give them the right tools? So I'll kind of encourage everyone online to take a moment and think about a hack that you have created when you didn't have the right tool and recognize that that is a moment of creativity. And isn't that amazing, right? That we in healthcare like to call ourselves not very creative people, yet find ourselves coming up with these extremely creative methods to get the jobs done that we need done. And that leads us here. As a healthcare person who discovered the power of design, we started the Health Design Lab in this concept of teaching design to healthcare professionals with this simple premise, right? That healthcare really is a black hole of design. I mean, once you start looking for it, you realize that there are opportunities to improve the design of things all around us in this space. And after a number of years of doing this work, we wrote a book so that we could share these concepts with others. This was authored by Bon Ku and Ellen Lupton, a lot of really fantastic case examples. But what I want to point to is getting now into the how. Like, how do we use design in healthcare? So I'm sure a lot of people have heard the term design thinking. It's become pretty much fully popularized now. It's used in so many industries that it's pretty much ubiquitous. However, what we did is we contextualized design thinking for a healthcare audience. Design thinking itself is a methodology for generating ideas and solutions that serve human needs. And it uses pretty simple tools, but tools nonetheless that need practicing and learning, such as sketching and storytelling, building physical prototypes, and even role-playing to help teams build empathy for the users that they're creating things for. And many of these tools honestly work very well in healthcare to solve these challenges that we find ourselves with. And a couple basic concepts within the health design thinking process as we define them are these two essential mindsets, right? We have human-centeredness on one side and creativity on the other. And while some of these might seem like kind of obvious things that people who consider themselves to be human-centered or creative will do, there are hard skills that go into actually doing these methods well. And they require, like I said, learning and practice, and it takes time to master. The process itself, the design process, is a cycle of iterative loops, And it begins with that human-centered sign, and you can see some of those concepts, but many of them are just based around simple techniques of observation through the imaginative process and into into that creative process of making things, prototyping, right, and getting that feedback so you can improve it over and over again. And the one concept I think is absolutely essential, and it's one that we tend to overlook as people who work in healthcare because we see ourselves as very empathetic individuals, or else we wouldn't have gotten into healthcare in the first place. It's this concept of empathy. And what does that mean? It's an absolutely essential starting point for any design process, and it's not a box to be checked, right? Our definition of this is really, to put it simply, understanding the mindsets and needs of others. But even before that, you need to stop and you need to understand who. Who are you designing for? Very frequently, what we'll do is we'll start solving a problem without necessarily defining who we are solving it for. And just by doing that kind of, it's not always simple because sometimes who are many different kind of categories of people. But by doing that process first, you save yourself down the road, right, from that terrible feeling when you present your wonderful solution and you're told, but what about this person? Right? That person that you may have not fully considered their needs and what the repercussions of your decisions were. So we're always challenging people to ask this question, right? On that concept of who and how do we learn about them? This concept of who are experts. And to a designer, right, unlike the kind of traditional scientific definition of an expert, to a designer, anyone can be an expert, right? And we put just as much weight on the importance of firsthand lived experience when we're trying to learn about a problem as we do, kind of that traditional credential type of experience that we're all used to. And I'm going to try my best to, even though we're on a webinar, engage you guys the best I can. So I want everybody to take a second and think about a time when you leaned on the experience of someone else, but not in that traditional sense, right? When you learned from somebody's experience, when somebody gave you that anecdote that made you realize, like, wow, like there is a better way to do this. This is a great idea. I had no idea how hard this was for you. Those types of moments are pure gold when you're trying to design a better solution. And the more you practice that, the better you get at recognizing when you have an insight that's really valuable from somebody who you maybe didn't expect it to come from. All right, so that's the design thinking 101 for everybody. So now I feel like I've done my job as an educator and left you with some new concepts maybe. And having you to introduce you to these ideas, just to kind of restate what our goal is in the Health Design Lab, our goal is to reimagine healthcare and promote human-centered design that leads to better products, services, and spaces in healthcare. We get the question all the time, what do you mean by design? Like fashion design, right? Everybody wants to put us in some type of familiar design box, but we don't do that here, right? Our goal really is all-encompassing because all of these things affect healthcare. Spaces, products, services, experiences, you name it. All of those things together make a great or a terrible experience for the people who are engaging with the healthcare system. So the engine of everything we do, however, is medical students, and that's what we're here to talk about today. So how do we do that? How do we engage with medical students? So I'm just going to get into some of the nitty-gritty about, how do we engage with what I consider to be some of the busiest, but also best learners that exist in higher education. The way for that is that here at Jefferson, we have, and within the Jeff MD curriculum, which is what our curriculum is called, we have something called scholarly inquiry, which we shorten for SI. So I'm going to start saying SI, but that's what I mean. And you can see it here on this chart. It's kind of the inside of the rainbow. And this chart symbolizes, the 4 years of medical school that are split into 3 phases. And the scholarly inquiry, that track that you see there, goes across all 4 years. Students can actually select themselves into a track. They can elect a track to pursue their scholarly inquiry around that is totally according to their interests. And there is 7 tracks as you see them listed there. And it continues, like I said, through all 4 years, and design is 100% the best track. That is my unbiased opinion. We're the best, no doubt about it. But But in all seriousness, right, a majority of our 250 students in our classes each year do not select design. They select, more kind of traditional scientific, tracks that are based around scientific exploration and research, such as clinical translational research. And what we tend to do is we tend to attract a lot of non-traditional students, second career students, students who were, let's say, designers or engineers in a previous life, such as the two women we have on the call today. And I think that is wonderful, right? Because again, to kind of restate that perspective of a designer, all of those experiences are important if we're going to try to improve things. And we wanted to have a place where people can be physicians and designers and engineers and leaders and all of those things. And this program essentially nurtures that and gives them the space and capacity to explore those things. The curriculum is broken down as you see here. Year one and year two really are kind of those introduction to the practice of design and design mindsets. Going through our classes really are more like workshops. And so you're both learning, our students are both learning and then practicing design at the same time. In our first summer, we have an optional product design intensive called Jeff Solves, which I'll talk a little bit more about in a second. And then in years 3 and 4, our students apply what they've learned in clinical rotations. One of the things that we love during that phase is that they look for design failures, like the ones I showed you here, and they collect them and they bring them back to our group and we talk about them and talk about how we can maybe fix them. And then we also have a design research fellowship slot available for any students who take a gap year, which I'll talk a little bit more about in a moment. So, in our teaching of medical students, we borrow many of the concepts that are in traditional design education, a lot from industrial design and other types of design. Our classes, like I mentioned, our workshops, they're all kind of longer. They're like 2 to 3 hours, and we try to make them as engaging as possible, where they're both learning and practicing at the same time, just like how you learn medicine, right? Students, one of the important things that students can select and will select and work on a project as a team throughout at least 2 years, but generally throughout their entire 4 years of medical school. This kind of becomes one of their primary research projects. And ultimately, our real goal isn't to make doctors designers. Our goal is to create a doctor of the future who is inoculated against being carried by the inertia of this like complex and poorly designed healthcare system that we find ourselves in, right? We give them the tools to be able to see the problems clearly and have and be empowered to start understanding how to move the needle on improving them. And it really is an ecosystem, right? Because the work that we do is pretty unusual. So it's not like there's a ton of places like this. So we work really hard to create an ecosystem of research and exploration for students. And it spans everything from, medical education and how you teach to product design, to community health, and then of course medical visualization and 3D printing is a big part of that. I feel really strongly that it was a good idea for the 3D SIG that used to be the 3D printing SIG to now just be the 3D SIG, right? Because technologies are moving so fast and how we use them and the value they provide is always changing. So again, these are really important technologies to expose our learners to, because they will be the ones who will be called upon to make decisions for how we use them and the value they provide both to us as caregivers and patients in the future. From a medical imaging standpoint, our imaging data and 3D printing are super important sources for projects for our students. These technologies are pretty accessible, right? Students can learn them. Medical students are in a perfect place to, based upon their education, to learn how to segment and learn it very quickly, especially the students who tend to be in our track. And for a subcategory of students who are interested in specialties like radiology and surgery, learning to segment and print cases is such a good way to solidify concepts in anatomy and physiology, as well as engage directly in collaborative research, right? These research projects always involve multiple specialties plus the lab, and our students are right in the middle of all of it. So without kind of this capability, the capability of doing segmentation and 3D printing, I think we would be leaving out like a really great opportunity for our learners to get exposed to it. So these days, looking at our medical visualization work, most of our work falls under the research and education buckets. We don't do a ton of like high volume clinical work. Most of our clinical work is under the umbrella of research, right? So think a collaborative research project, which you'll be, Sara and Ray will be giving you some examples of in a bit. And as I said, our medical students really are both the technical and project managers for this research. They have a hands-on, and I've seen it over and over again, students coming in having potentially never led a project as complex as clinical research, and then leaving having had that experience and really, learned a lot from it, and then really rose up to that challenge and were able to make successful projects based on that. And to give you examples of the types of projects we're working on, and when I say students, I mean medical students. I'm going to stop saying medical all the time. So our students work with physicians across the enterprise on complex case printing. A lot of one-off, really unique cases will be brought to the lab, and I'll immediately put a student on it and start talking about how this would be a wonderful case report, and kind of encourage that process early on. We collaborate with clinical groups on like higher volume clinical research, such as, testing out the feasibility and value of, patient education or pre-surgical planning and things like that for different specialties and procedures. We work with a lot of different groups on developing and testing procedure simulation devices, right? We're not a specialized simulation lab. There are some, really incredible sim labs out there. And I've gone to visit some of them, and it's amazing what's possible. However, a lot of, educators will come to us with some pretty simple needs, and we'll be able to respond to them and make some bespoke trainers, and show a lot of value there. Now and then we'll also take on special projects and things like rehab, OT, and PT to make personalized, patient care devices, and of course all kinds of other interesting prototyping projects that come to the lab as well. And all of them, right, go right to a student who with that focus on an academic component, because without that academic component, it really is that essential engine for our design research ecosystem. So our 3D printing lab, as you see behind me, right here where I'm sitting, is a super important tool for our academic mission. We have a small core resource bioprinting lab as well that I co-lead with a PhD researcher here at Jefferson, Ryan Tomlinson. Generally the focus of our lab and how we make it, or the kind of technologies we have here, it really is a focus on easy to use and maintain accessible technologies, because again, we want our learners to be able to access them, versus a more complex technology where it'd have to be less, there's have to be somebody in between our learner and the technology. And what we use these tools for has changed over the years, but 100% our medical students have always been the primary users and benefactors of this work. And then the other thing I'll mention is that a select group of medical students will get educated every year on segmentation. We use Materialize for our segmentation. Generally, these are our fellows and maybe a couple other interns. And these are the students who tend to drive a majority of our projects that involve 3D printing specifically. Now, quickly, I want to talk about our summer product design intensive. I had mentioned it briefly. It's called Jeff Solves MedTech. This elective summer program brings design students and design professionals in to work with our medical students with their projects to accelerate development. We are in the midst of our 9th cohort right now, which is crazy to say. And and the reason I bring it up here, it's another really important use for our design and 3D printing capabilities. Having the capability to not just 3D print things, but everybody who has experience in 3D printing knows that the design and engineering step that starts first is really where the value is generated. So our expertise in both of those spaces allows us to accelerate the prototyping process, leading to rapid development of new products. All of these products go through some kind of patent review, and the reason we do it is because our medical students will get high intensity experience in product design, kind of get that kind of taste and feel for what a incubator, right, could look like in that summer between their first and second year, which is pretty much the last bit of free time they may have for, in some cases, a decade, which is crazy to say, and that's why, we make sure we provide a lot of value, a lot of targeted value with that time, because the students who elect to spend their last summer with us, we want to make sure that they leave having had a good experience and learned a lot from that process. So that's mostly the end of my spiel, and I want to introduce our two students on the call. So we've got Sara Belko and Rachel Monane. They were both fellows last year. They have now since graduated our research fellowship and have moved on to third year. They're actually the class of 2026. I think I messed up when I initially sent their info in, not 2025. You're not there yet. Sorry, you're not graduating this year. I know you wish you were. So Sara was an engineer in her past life. She's interested in radiology and radiation oncology. Her goals are to advance the collaboration between the fields of medicine, engineering, and design through education and 3D printing. And Ray was in business and research development in a past life. She is interested in psychiatry and internal medicine, and Ray aims to fill patient need gaps with innovative design ideas, working with interdisciplinary teams. And they're both really good at what they do, so I'll let them speak for themselves and hand it over to Sara to start us off.
Thank you. So just a little super quick background on top of that. So my name's Sara, and I did my master's and bachelor's in biomedical engineering at Arizona State before going to med school, actually before working in industry before going to med school. So you'll see that Ray and I are both career changers. But in terms of myself, I did 2 years in the lab, as well as I now am in certain specialties that I got from experience in the lab, so radiation oncology and radiology. So when Rob reached out to us and was like, yeah, we're going to do this. We're going to talk about design and 3D printing for a medical student perspective. His questions to us were, why did we choose SI design or scholarly inquiry design? And what does 3D printing bring to us? So to answer the first question, why did I choose SI design? So as you saw in Rob's pictures, there's about 7 different tracks that we can pick from. So why I chose design was that I was able to use my engineering background and work experience, not only like creating a product or looking at different things, but also really learning human-centered thinking on the ground, like boots on the ground in our units that we have in the hospital. So being face-to-face with the patient. Another reason why I chose design was to explore and participate in specifically innovation in healthcare. Design as well as 3D printing are at the forefront of innovation and looking forward into the future of what this healthcare system is going to be looking like 10 years from now, 20 years from now. Being able to experience that and really get that experience as a student before becoming a full-fledged doctor has given me the safe space to really be involved in innovation and like grow that passion I have. And then lastly, learning different skills that medical school does not necessarily teach us. So in health design thinking, Rob mentioned we have like role playing, we have the creative mindset, but beyond that, beyond those like kind of skills that are given names, there are also a lot of important skills like building resiliency and like creative confidence to be able to speak up when you think something's wrong, or like conflict resolution with working in teams. These are things that med students don't necessarily learn until they're on the wards and like during their clinical rotations or even in residency. You can click the button. So just to give an example of what my SI design project looked like. So my team was looking at people who use wheelchairs. So there's 75 million people who use wheelchairs or over that amount, and they transfer themselves 11 to 20 times a day. So we really looked at this patient population that's very vulnerable and as well as underserved. And so we decided to go through the entire design process. First, we interviewed them. We gathered different anecdotes of what they were going through. So like people were afraid to touch the toilet in public. People were afraid to fall, and people were afraid to potentially that the toilet seats that they were experiencing might actually break underneath them. So in true design fashion, we ended up immersing ourselves in the environment. So we created our own bathroom, and we learned how to transfer over to a toilet from a wheelchair, even though some of us were not people who use wheelchairs. So we really wanted to understand what their perspectives were. And lastly, we did a needs assessment of what this potentially undervalued patient population really cared about. So we found that people found that toileting was difficult, that they were uncomfortable using public toilets, as well as they really feared for sanitation, safety, and ease of use. So this led us to, and this one has the transitions, thank you, create a needs assessment of how might we improve safety and sanitation during a self-transfer to the toilet. And so this is where I kind of integrate 3D printing a little bit. 3D printing in this project allowed us to do rapid iterative prototyping. So you can see on the left side of the screen, we had these are just 4, but we had at least 6 to 8 different prototypes that we 3D printed and we used, and we actually like talked with patients about. So again, 3D printing allowed us to do a very iterative, rapid prototyping, which ended up looking like our last product, which is, you can see on the right, it's called Grip and Go, which is, it's like this handle and a clip that allows patients to be able to hook it onto the toilet and transfer themselves over while not gripping onto the toilet or gripping onto the handle instead. Yeah, so that was the first question. So why design? And an example of how we use design and 3D printing as a medical student. And so now answering the question, what did 3D printing bring to me? So to me, 3D printing brought 5 major things. The first one was specialty exploration. So as I mentioned, I kind of landed on the my specialty interests of radiology and radiation oncology through the projects that I've been doing, as well as like 3D printing and medical segmentation. So for me, I wouldn't have been able to explore these specialties without these experiences in 3D printing and medical segmentation, because we actually don't do rotations in radiology or radiation oncology until elective rotations during our 4th year. So it's not like they're not basis ones like surgery or emergency medicine or things like that. So I got to be exposed to them early, so I know I'm going to choose one of them. Another reason or another thing that 3D printing brought to me was learning how to read imaging. Throughout the first 2 years of med school, we are taught how to read CTs, MRIs, X-rays, but not really taught. We're kind of shown examples and like told to memorize them. So actually the medical segmentation 3D printing allowed me to learn the skills of how to actually scroll through CT scans, MRIs, and like pick out little minute things here and there. So now being in the wards and actually on with patient cases, I can read those images, like read those images pretty well. My third thing that it brought to me was research design and methods. Rob mentioned this many times that a lot of the students, including us as fellows, we got to take on these projects and learn how to do research processes, as well as designing of the research study and how to implement it, and data analysis and all that. My fourth one, kind of going back to like design, 3D printing allowed my group and I to do rapid prototyping and iteration, which we all know by now 3D printing is great for that. And lastly, being exposed to clinical procedures and processes. in terms of things that we wouldn't normally see during our clinical rotations or even during residency. 3D printing is kind of integrating into a lot of different clinical processes that gives us exposure to these things. As an example, if you hit the next slide, I'm going to talk about a fellow project or a project I had as a research fellow in the lab, and what this kind of clinical process was. So a little background to this project is that prostate cancer, metastatic prostate cancer, is still very lethal today, even though we think of localized regional prostate cancer is easily resectable. We can use hormone therapy with it. However, once it gets to the metastatic part or moved past to the metastatic, it's only 32% survival rate for 5 years. And you can see on the right side of the slide, basically once it's unleashed, it's unleashed. It doesn't just go in one place. So currently in America, we just brought in, the FDA just approved of, it's called lutetium PSMA 177. And so this is a specific type of radiation that is injectable that targets and latches onto the PSMA, or the prostate specific membrane antigen of metastatic cancer or metastatic prostate cancer. So again, this just got approved in the FDA. It's been used in Europe for years. And so right now we are looking at trying to make it the most efficient way, the most efficient treatment planning, as well as decrease potential toxicity in patients. So in this type of treatment plan, lutetium, it ends up actually settling in the kidneys because the kidneys excrete it from the blood. So in relation with the radiation oncology department and physicists here, we ended up 3D printing a representative phantom of 2 kidneys that allowed us to, you can kind of go to the next slide. You can see on the left, these are what it ended up looking like 3D printed, but it allowed us to scan these kidneys and be able to do different dosimetry measurements on them to be able to kind of longitudinally keep track if patients are having certain toxicity levels to this drug. So on the right side of this image, you can see this is a PET CT scan, 2 kidneys floating, and with, again, it was a certain amount of lutetium in this case, but so we're able to measure toxicity levels, if you will. And then just a little side note for suggestions before I give the floor over to Ray. So some suggestions I have for medical students in design and 3D printing and like this innovation world is to take the time to continue to develop or potentially continue skills that you've already had and passions you've already had. Medicine is always going to be there. And really, like, residency, clinical practice is within these skills, these not just these interpersonal skills and these skills that we have moving forward. So in general, take the time to develop them / continue them from pre-medical school. And then for professionals in education and 3D printing, my biggest advice is to really broadcast 3D printing to med students during the first year / the first summer, because as Rob mentioned, after that, we kind of get overwhelmed with graduation requirements. So in terms of like getting to us to be interested in it and then moving forward throughout the 4 years. So thank you. I will pass it over to Ray.
Hey everyone, my name is Ray. Just to give you a brief background, my undergrad degree is in business. I worked in consumer packaged goods industry for a couple of years, and then decided to pursue medicine. So I actually worked full time in kind of escalating roles in clinical implementation while I did my post-bac and a little while longer, and I made my way to medical school. Next slide. So kind of my reasons for pursuing design overlap with Sara's, but just to give kind of an array. I love a good puzzle. I think what's really great about the problems that we get to solve in the lab and in Design SI is that they are really problems that they're facing in the real world. It's very nice when we get to learn about these like theoretical concepts, but a lot of what ends up preventing interventions from succeeding ends up being like when rubber hits the road, kind of on the wards, when patients use them, or when providers are kind of evaluating the practicality of actually giving things to their patients. So there's kind of innumerable ways where you can even start out thinking you're solving one problem and realize that the true problem is completely different, and you start a new puzzle. And so there are a lot of components of it that I loved, and that was also something I loved kind of in brand management. I also really love the idea of being able to bring a tangible deliverable to life. As Sara mentioned, a lot of the first 2 years of medical school are very didactic heavy, as they should be. We need to understand the pathophys of all of the treatments that we're going to give to patients and understanding how their diseases progress. But I think a lot of it ends up being kind of a very cerebral exercise where you don't actually necessarily get a tangible deliverable that you can like touch and feel and easily explain to other people who aren't necessarily in that specific area. And so I really love the kind of tangibility of what you can produce. And it also allows for me to kind of be able to apply the past practical work that I've had kind of throughout my career, and actually use those skills that I've gained kind of in business and actual research implementation to produce things that actually help patients and providers, or ideally both, as they don't necessarily need to be competing. So next slide for me. To give you a little bit of context, this is my kind of intensive med tech project that I worked on with a team of industrial design students. So just to give a little bit of background, patient ambulation, we know, can lead to quicker discharge, reduced complications, and better long-term outcomes. Conversely, not ambulating can lead to kind of negative implications, including risks after patient recovery, especially like a deep vein thrombosis, for example. So the medical community has come to realize the importance of walking, especially after surgery, and kind of the literature is trending to only increase that in the future. And so, but if you've ever been in a hospital or any healthcare environment, you know that there are a lot of challenges for patients who are attempting to walk within a hospital unit. Aside from the fact that you're wearing those delightful gowns that Rob showed us earlier, you're in socks with little grippers on the bottom, navigating through doorways, kind of around a cluttered environment that has lots of important medical peripherals, but you have, you know, IV lines and pumps and catheter bags. And the reality of what that experience is like doesn't really allow patients to do the ambulating that we want them to do. And so while healthcare has rapidly evolved, the IV pull has remained largely the same since the early 1900s, with the addition of some wheels at the bottom. And so what we as a team decided to do with an inpatient surgical step-down unit nursing team, we kind of interviewed everyone across who touches this product. So we even met with kind of supply chain to find out what components that they cared about most when they were looking to purchase these kinds of products in bulk for, and even how they disinfect them, what the process is within the hospital if they break. Talking with nurses and medical assistants who are actually working with patients as they do their prescribed exercise while they're on the unit. And so kind of speaking with everyone with OT, what the appropriate way to actually walk with an IV pole at the correct distance and angle from your body. And so what we came out with was we wanted to create an IV system designed for ambulation. to improve patient and provider experiences, safety, and utility. So how that ends up looking is, sorry, would you mind going back one more slide? So essentially we focused our design on 3 components. One was kind of, initially we had thought about kind of reconstructing, just fixing the one component that was an issue, but we really discovered that there were issues with kind of every part of this ubiquitous medical equipment. And so we decided to kind of think about it from the 3 most important components. So the first was kind of an intuitive, comfortable handle that actually allows you to maneuver. So suggesting where hand placement should be. They're not prescriptive, but they're kind of like indicators as to kind of holding it at a distance that is comfortable and safe for you to be ambulating in terms of actually driving momentum through the handle pull into the base. And getting even the diameter of the grip so that it's ergonomic and comfortable for patients to use, and allows for you to actually maneuver the device. The second was the ability to adapt between walking and stationary states. So being able to actually create something that had a footprint that could easily stow bedside. So that little kind of notch in the front actually fits next to the wheels of a patient bed. And we wanted to have something that patients could actually do themselves. So there's just kind of like a release button, and they're able to kind of release from a stationary position to an ambulatory one, and to actually even turn in small spaces like patient bathrooms and even tight corners around units where you might not have as much clearance as we would like. And third, we thought about the stability of the base, especially with all of the modern technology that we now use to ambulate around. We wanted to make sure that we were creating something safe for patients that actually had implied directionality and gait allowance. So there is actually, so no more toe injuries while patients are ambulating around the unit, and actually anticipating where their steps are going to be and allowing them to actually orient the position of the pumps and other items that providers need to access for patient care in a kind of consistent way where it was facing their needs and as well as meeting patients' needs. And I mentioned yes, thank you. And so just a kind of a little preview of what went on behind the scenes is we were able, because of kind of 3D printing, to rapidly kind of go through different solution iterations. So for example, the base, we actually made small, we were able to bring 30 bases to the nursing unit and ask them for feedback on like the initial components of how we wanted to kind of orient that base in a unique way and in geometry that made sense. We were actually also able to iterate on the adapter, which would ultimately not be made out of plastic, but it was to allow us to actually figure out what the best angle would be and for rest and for ambulation, while also targeting the right handle shape that communicated to patients how they should be using the device. So briefly, kind of to answer the question of what 3D printing has given me, I think it's given me access to really people who are in the peak of their careers in fields that I frankly hadn't known a lot about beforehand, but have really grown to appreciate. And I'll talk about 2 examples after this. But getting to talk to people and really hearing about what their day-to-day is, and also finding ways to allow them to better communicate the things that they're working on is really fulfilling. I think it also gave me exposure from the entire process of like thinking about how to design, coming up with the finished product, and then also even getting to kind of learn about the patent discovery process and application, and been fortunate enough to get to participate in it. Understanding anatomy beyond in situ, it's very nice to be able to look in a textbook, but as you'll see, as I'm sure people know, in reality, when you're kind of doing patient care, different specificities from pathology ends up kind of greatly changing where you expect to see different things. And I think the exposure kind of allows you to have a more malleable model in your mind of kind of where organs sit, and has definitely made me, I think, a better physical examiner in thinking about what I'd be looking for while doing even just a physical exam. And I think 3D printing has really allowed me to appreciate the ability to allow ideas to actually be placed in the hands of users. I think the best feedback that we got when we were designing Motivity, the IV poll system I mentioned, is really actually bringing it to the unit and having it be high enough fidelity that the nursing team could get excited about it and could give us really good feedback on how to improve it. And that's kind of when we took off. There have been a lot of great benefits for me, and I'll kind of briefly go through. We were able to work with a thoracic surgeon, and he wanted to develop a functional model that would actually allow for patients before they undergo a surgery for pes excavatum to see kind of the before is kind of on the left and the after is kind of what the profile looks like with those bars. And ultimately our model was actually used to film a video that he's going to be showing patients in the future. And the next is a study that we worked on to develop. A previous iteration took patients who needed to have partial nephrectomies, and as an initiative to provide either patient education for prior to the OR was actually we segmented and then printed patient-specific models for specific before they went into the OR with their specific pathology, so they could have a better understanding of what exactly was about to be done and why it was necessary. And so in this iteration, what we actually did was we took kind of more complex pathology and we kind of went through all the stages of segmentation with existing patient scans, but we're able to develop patient-specific models that, if you go to the next slide, the models ultimately were kind of simplified anatomy of just the structures. So like this was a kidney, for example, with a very large tumor. And it's kind of hard to visualize, especially if you're not someone in the healthcare field. And so this kind of allowed patients to be able to manipulate in 3D space. So without even doing the 3D printing component, we were able to make something that we were able to turn around rather quickly for patient-specific anatomy. And they actually were able to kind of spin it in this viewer space, so they could kind of view it in 3D and manipulate it to gain a better understanding before they went into the operating room. And so my advice for students is that an increasingly competitive residency environment, I think everyone's looking for ways to stand out. And I think this program has really allowed me to be able to demonstrate my problem-solving skills. Nothing works out the way you think it will the first time. And I think being able to iterate and kind of talk through how you were able to get to the next steps is really a valuable benefit. I think the opportunity to team up with professionals and other students who have varied expertise from your own really allows for additional perspectives to add value to your ultimate product, and really tells a great story as to why this is what should be the solution. And I would say definitely don't feel like you need to 100% commit to the first workable solution you produce. It's really fun to be able to tinker. It's okay if it's not the best possible end product on your first go. Failures that you learn from are still wins.
And that's it. Thank you. Beth, Aaliyah?
This was totally amazing. Thank you so much. Fantastic. I know we're almost at the top of the hour. I don't know if there's any questions from the audience, last minute questions. We did have a comment from Brian Patterson saying what a great talk this is, and that he loves the idea of pushing this education further into the first year of medical school. I think it's really fantastic that you're teaching design thinking, and your experiences are really amazing.
Yeah, I think that's a really great takeaway right there, is that like there is a very small window to engage with medical students, and it really is like right at that, in that first year, they're thinking about what is the research I'm going to do, what lab do I want to engage with, and finding any way to kind of make that connection early on is super important.
Fantastic. Well, thank you so much. I know we're at the top of the hour.
Yeah. Oh, and I gotta make one pitch before we
Yes, go.
leave, okay? So there's one pitch, and so I was stalking out the Journal of American College of Radiology to see if it had gone online yet. It hasn't, but nonetheless, I want to congratulate Dr. Ken Wang and the research team and tell everybody online to look out for an article that is going to be coming out in press very soon. That is a research publication led by Dr. Wang on the use of the RSNA ACR 3D printing registry. So I didn't want to waste an opportunity to pitch that. Look out for that work. Many people have their hands in it, years of work, and it'll be out in publication and JACR very soon.
Fantastic. What a great high note to end on.
Yep.
Happy Tuesday, everybody. Enjoy your day. Strong work as always.
Thank you. Thank you for having us.